Hey everybody, I'm Dr. Dino Pappas. We're back with the We Fix Pain podcast. This is episode number 6. We're with a special guest today, Dr. Cindy Howard. Dr. Cindy Howard is a functional and integrated medicine practitioner. She practices out of the south suburbs of Chicago, Orland Park. She's taught around the world. She's taught specific classes on functional and integrated medicine. She is a colleague. She is a mentor to my wife. And she is a good friend. So, Dr. Howard, welcome to the podcast.
Oh, it's so great to be here. Thank you for having me. This is fun.
Yeah. So, we're looking forward to a little bit of a deep dive here in a second about functional integrated medicine, your niche, your specialty, your baby. But first, there's the get to know you portion, just like a first date. Let's talk about your origin story. How did you end up as a chiropractor, and what turned you on to functional integrated medicine, something that you do very well?
Yeah, well, thank you. You know, actually, it's kind of funny because when I was younger, I had absolutely no ambition to be a chiropractic physician at all. It was never on the radar.
Great start, Doc.
Didn't even want to grow up and be a doctor of any kind. Actually, I wanted to be a dancer, which is, I guess, sort of not real related. And through a series of events and actually majoring in exercise physiology in undergrad, the goal was actually originally then to go the physical therapy route. And at the time, and this will go to show you how old I am. At the time, physical therapy was very, very competitive. And I almost hate to admit this, but I wasn't the most outstanding student in the world, so the grades were lacking just a little bit. And I had a lot of trouble actually getting into physical therapy school. So somebody said to me, and this is so ridiculous, but they said, why would you want to go to physical therapy and be told what to do when you can go to chiropractic school and tell the physical therapists what you need them to do? And my little flag went up, and I'm like, oh, that's brilliant. I love to tell people what to do, so I'm going to check out chiropractic school. So I did, and I only had one experience when I was in college with a chiropractor, actually, after a car accident. So it was interesting that I kind of went that path, right, without a whole lot of history. And when I was sitting in chiropractic school, I wanted to be a sports chiropractor, like about 85% of my class, because I'm also an ex-athlete and I love sports. And, that was the coolest thing to be, was a sports chiropractor. And it's still a very cool thing to be. But I was sitting in an obstetrics and gynecology class, which I didn't even know you could take as a chiropractor, right, as a chiropractic physician. And my mentor at the time, Dr. Frank Strahl, who I love and miss dearly, talked about genitalia and diseases and examination processes, and I'm trying to keep this a little on the cleaner, with the filter side. And
this may be a conversation at a bar at a Friday night, right?
Kind of, and I typically have no filter, so I was going to say like penises and vaginas, and we're already there now, so that's what it is. But he was teaching obstetrics and gynecology, and I thought, this is actually kind of cool. I didn't know as chiropractic physicians we could really take this primary care route. I had no idea. And it was really due to that mentorship that caused me to really do sort of a 180, right? I went in this direction from sports to completely the other direction in an internal medicine nutritional realm. And now I take care of athletes on that, on that continuum, but not as a sports chiropractor, but as a, chiropractor who has a very broad-based internal medicine type practice. So a little sort of weird path, I guess, but nonetheless, it brought me here, and I love it. It was how.
Doc, I expect nothing less from you.
Yeah, right. There's always got to be a crazy story, for sure.
That's right. Well, we're glad to have you do this because I've learned a lot from you over the years. And full disclosure, I have an appointment with you next June 8th. I think it's 2 weeks from now.
Awesome.
So
great. We're
going to dive down into my fatigue issues.
We're absolutely going to do that. We're going to get you exactly where you need and want to be. So I look forward to
that. That's right. So we got into your origin story here a little bit. I like to do a segment, 5 fun and random questions, whatever's deep inside this brain here, whatever comes out first. So you can't prepare for it. These are not prepared questions, not one bit. So let's start. Your dream vacation, what would that be?
I've already had it, actually. So I have. The dream vacation was the Amalfi Coast in Italy. And it was everything.
Nice.
Yep, it was everything it should have been. And I'm really proud to say I've had it, because why wait, right? Like, so, here's the unasked for advice, and that is
if you have a bucket list, why are you waiting, right?
Go take it. Yep, so I've had it. So I guess, I don't know, maybe the dream is over, but you know what? The dream is, I guess, the follow-up. I actually want to spend more time in Italy and see more of Europe.
Nice. The moment when you realized you were turning into your mom or your dad?
Oh, wow. You know what? That's like a series of moments, isn't it? Like it. Like, I don't know if I remember the exact
I
time
had a
they.
dad moment where I realized, shoot, I'm turning into my mom and my dad, what I said to my child.
Yeah, I think parenting definitely does that, right? But I know there are things that come out of my mouth, and it's almost like you can hear, and it was really more my mother, right? You could hear her voice, almost like the exact tone, and then like you don't know whether to be really proud that she taught you well or really mortified that she taught you well, right? I think it
And they
goes
told
both
you you were going to
ways.
turn into it too, and you're like, not me. I'm going to dodge this. And it
Yeah, no,
happened.
I'm definitely parts of both my mom and dad, and yeah, there are things that come out of my mouth still to this day that are very much both like them. I wish I could tell you the exact moment. It happens too often, way too often.
All right. So if you had, you're out Friday night, Saturday night, somebody is getting you a drink, what are they buying you?
Wow. So most of the time it's water with a lemon. But if I was actually going to have a drink, then I'm a pretty expensive date. It's going to be, probably Blue Label neat.
Nice.
Yeah.
I'm a White Russian type of guy. I don't know how I started or why I started with it, but it seems to be smooth and it's got a little bit of a kick to it as well. Okay, got two more questions here.
That's not a fair question for a doc that does nutrition and internal medicine, right? You know that.
Fair point. I got to rethink that next time I have you on the podcast. I'll make sure we edit that one out.
Right, like what is your favorite fruit and vegetable would have been a little more appropriate so that the audience gets that, right? Okay, just say it.
All right. So question 4, what's your favorite fruit and vegetable?
My favorite fruit is going to be blueberries. One, because I just happen to love them, and two, they have amazing health properties, so you get the twofold, right? So there's the doctor answer for you. And my favorite vegetable, wow, I actually really like vegetables. I'm going to have to go with asparagus. I really like crispy asparagus. The little lemon pepper on it, yeah.
Oh, yeah, I like the way you roll. I do a good grilled asparagus and squeeze a lemon, fresh pepper on there. Like you said, that's the way we do it at home.
Yeah.
I think the fruit, I'm a seasonal guy. Right now, watermelon's in season. I enjoy watermelon. I miss because I'm in Texas now, the Michigan cherries.
Okay.
Those Michigan cherries were phenomenal. I like the thickness, the juice from it. Those were nice. All right, last question. Vacation home. You got to buy one. You going to the beach or you going to the mountains?
I'm going to the beach. I'm a Pisces. I love water. It's where I recharge. Definitely water.
Awesome. My girls love the beach, so that's where we're headed as well. I'm a seasonal guy. I could go either way, but hey, girls want to go to the beach, let's do that.
Yeah.
So, Doc, now we got the fun stuff out of the way. For the layperson, what is functional integrated medicine? I think there's myths and misconceptions. Let's clear it up. For the layperson, what is functional integrated medicine?
Yeah, so it is a little confusing. So integrative medicine by itself is really the ability, just as it says, to integrate, right? To integrate different types of care. And a lot of times that's assumed that we integrate both what we call alternative medicine, and I hate that word alternative because we shouldn't be alternative. We should be, first choice a lot of times, but the complementary alternative medicine, as it's known as, in combination with Western medicine, right? So utilizing both traditional medical treatments with some of what we would then consider those alternative medical treatments. And that's really, the true definition of an integrative medicine. But it also can be, deemed integrative just in terms of different types of practitioners, right? Like, a chiropractor might integrate with an acupuncturist, that might integrate with a massage therapist. So I think it can be interpreted a couple different ways. The functional medicine piece, it's funny when you throw out that word. I actually don't really love the term functional medicine. There is no such thing as like a board certification in functional medicine or a doctor of functional medicine. We practice that way. And really, the best way I think for your viewers to really understand that is we look at metabolic, biological, physiological processes in the body. So all that stuff in science class you swore you'd never use again that we use every single day, because our cells are functioning on that level, and really finding what went wrong, meaning the underlying cause to certain things. So when we have symptoms or we have disease, we didn't just wake up with those things. The body did something incorrectly to get there. So it's really searching for those underlying triggers or causes. And when you can figure that out, making those corrections to eliminate the symptoms and then therefore the disease, and that's really where I think functional comes from in terms of that name, functional medicine.
So a couple points I think you made that are important is that, we as chiropractors, we get lumped into the alternative medicine category, but is what we do really considered alternative, or are people just placing us there just because it's a little bit different? And I think you're right. I think when we talk about functional medicine, it's a term that we utilize, but the public, can you help me or you can't? It's binary, right? Yes or no. So I think we get caught up in that role a little bit too much. So how do we utilize this tool, this lens then? How do people like practitioners like yourself utilize this lens evaluation to help patients out?
Yeah, so I think the key again is really, it's like thinking about a puzzle, right? So if you think about the human body as a puzzle that we're trying to put together, you're not just a spine, you're not just a brain, you're not just a thyroid gland, you're not just, a toenail, right? We're all connected. So it's looking at the different pieces and how they integrate. So, when you have a issue, a symptom, a concern, it's figuring out what the pieces were and where they need to be placed in order to get that to function properly, or where we've misplaced those puzzle pieces that now we're not getting, the picture that we anticipated when you look at the box, right? If you put the puzzle pieces in the wrong place, the picture is fuzzy. So I think, that lens of looking at the body as a whole, looking at the person as a whole, and realizing that sometimes also where you have pain or symptom isn't necessarily the place that's causing it, right? And I always love to give this example musculoskeletally. Like if I put a pebble in your shoe and I ask you to walk around on it all day, you might have foot pain, but you also might get a headache because it affects your entire body all the way up, right? And functional medicine, internal medicine is kind of the same way. If we don't provide, let's say, the proper nutrients to the body, we could wind up with a certain disease, or we eat poorly, we could wind up with diabetes, or, right, and the list goes on. So it's really about all those pieces and making sure they're in their proper place and they're being nourished appropriately so that we don't feel ill. And I think that's the lens we need to look through, is a very broad lens to look at the whole body.
Yeah, there's weird, vague symptoms that manifest in patients from a musculoskeletal standpoint or non-musculoskeletal standpoint. And yeah, like you said, like figuring out why. In my neck of the woods where we play ball, it's the kinetic chain. In your neck of the woods, what number of reasons can somebody have a headache, right? I mean, musculoskeletal, tumor, infection, food allergy, vitamin deficiency,
hormone,
all of that.
Yeah.
So you're talking about using your filter and your skill set to kind of sift through that layers to kind of arrange that puzzle to get to the why.
Absolutely. And that's what we sometimes forget is, sometimes what's the obvious cause isn't really the cause, right? It's not always the obvious place, and sometimes it really is. And it's really about having that broad ability to make sure that you just don't rule things out, especially if it's not your specialty, right? We still have to take that into consideration.
Can you give me a couple cases off the top of your head where you talk about the process of putting that puzzle together? I'm sure you see these in your practice, and there's probably some examples where you can say to the average chiropractor like myself that does neuromusculoskeletal, or to the lay person out there, is there 3 cases where you can kind of give us just a general 30,000-foot overview of using the lens, finding a piece, making it match, putting it back to the patient?
Yeah, I think, oh boy, there's probably tons of those, and to come up with 3, that's a challenge just to narrow it down.
Yeah.
And I think the first one that comes to mind is actually just what you mentioned. We actually had a great case that we finished up, so to speak, a couple weeks ago, and it was a headache. It was actually a migraine case, right? It was a patient that had migraine. She was in her mid-40s. It was really the only symptom. She was a regular maintenance patient from an adjustment standpoint, so, took care of herself, and yet the migraines were still present. And what was interesting is on a micronutrient test, we found deficiencies in riboflavin, which is B2. We found some deficiencies in magnesium. We found some imbalance in her omegas, her fatty acids, her omega-3s and 6s that a lot of times we see. We saw some deficiencies in D and a little bit of K. And it was interesting that just tweaking the nutrients, and yet a good eater, right? I mean, she wasn't live on the fast food junkie circuit. A relatively good eater, but still just not getting the balance of nutrients she needed. And what was interesting is a lot of the nutrients she was deficient in, we even see in the literature as those commonly related to migraine headaches. So, getting adjusted all the time was great for a whole lot of other things for her, but didn't resolve the migraine headaches. And really from a nutrient standpoint, it was just easy and it was perfect. So that's one case. I think some of the more complicated...
So let's break that down a little bit. So problem solving. adjustments, manipulations, short-term benefit, maybe a little benefit. Goes some blood work. Aha, we see this, this, and this. Your next step was use that lens. Let's put a strategy in place to see if we can improve those deficiencies and see if there's a response in the body which ultimately decrease migraines?
Correct. And the nutrients, if you go back to, your biology classes, right, and whatnot in school, and when we were looking at just the function of the cell, right? So remember that little cell, and we drew the picture of the nucleus and the mitochondria, and we learned about energy and ATP.
You're giving me PTSD right now.
I know, and everybody's like, I'll never use this ever again, and I'm like, you kind of do every single day, you just don't pay attention to it, right? You take for granted that it's working. And really, that's the most basic, is when we get down on a cellular level and we give the body the exact nutrients it needs, really, then the cells do their job and it kind of works up from there. So I always describe that as like building a foundation of a house, right? Like if you're going to put up a house, you need a really solid foundation so that the walls stay erect and the roof stays erect, and when the tornado blows through, it withstands the winds. And at the end of the day, you might need to change out the wallpaper, repaint, or change out the carpet, right, over time. But really, that foundation is important. And on a cellular level, nutrients are just that. And it's a shame because even when we eat healthy, a lot of our soil is not nutrient dense, or we don't know where we're getting our fruits or veggies or other foods from. And we just truly don't know how balanced those nutrients are. And yet if we had that, quite frankly, that foundation would be really strong, and some of those other things that build on it may never even manifest. Sometimes we don't have to go any further. And that's why she was such a beautiful, simple case. And they're not all simple. I mean, that's just one example. And you know what? It's just such an easy thing to do. It is a simple blood test. You get values. You're either good or you're not good. And then, we supplement appropriately. It's just not a difficult thing to do, and yet so important that people miss.
What types of conditions do you typically see at your office, or what type of conditions do you feel end up at your door? Because I feel like, people start with the traditional route. I know you're a heavy referral practice, and you built an amazing reputation, and across the United States and international. You're like Pitbull, Mrs. International. But I know, but what types of conditions end up at your door? Just not through referral, like they've sought answers and sought answers and sought answers and they haven't gotten them. What conditions do you see filter through to end up at your door?
Yeah, conditions is interesting. Like if I'm going to answer that question, I'll tell you the number one is probably autoimmune disease. I see a ton of patients suffering with autoimmune, and the numbers are just crawling as far as the people that are suffering that. Anywhere, Hashimoto's thyroiditis is probably one of the most common ones. We see a lot of rheumatoid arthritis, lupus, a little bit of MS, tons of diabetes, right, which is autoimmune as well. It's just really prevalent, and I think part of the reason I see a lot of that is because there just really aren't great treatment protocols out there in the medical world.
Especially the thyroid.
Medications, right? Here's your drug.
Especially
and
the thyroid,
controls it
Cindy.
great, and if not, they just keep switching medications, and really that comes down to looking at stress. It comes down to looking at gut function. It comes down to looking at the foods we put in our mouth. There's so many different components to why our immune system goes rogue that they're just not looked at typically because they are time consuming, and again, it's that puzzle piece. But we're pretty successful in the office dealing with autoimmune from that regard because, again, we dive in. We don't just prescribe and hope that the symptoms get resolved.
Yeah, I've often said I feel the playbook for treating the thyroid's at least 50 years out of date. Especially the autoimmune variations of the thyroid problem, where the thyroid is the problem. No, it's not. It's the immune system triggering the thyroid. And then the investigation stops there. Mm-hmm. Folks don't know how to write the right tests to diagnose the autoimmune thyroid condition.
Correct.
Or,
the book. They don't know what to do with it once they have the diagnosis either.
No.
Yeah.
And I feel like rather than just wishing upon a star, they should figure out how to punt those to the person, or people out there that are trained to say, we need to dive deep to why the immune system is misbehaving.
Yeah, and it's interesting. I sit on a couple Facebook groups, and some patients have tagged me on that too, and it's very sad to me to see so many people out there who just, and it's the same response. Who do you go see? We can't get an answer. It's uncontrolled. We feel lousy. And yet they're searching for answers, and there are those of us out there that have them. It's just, it's really hard to find people that know how to do a thorough workup and then what to do with it. And then what to do with it beyond even just that failure, because nobody's a textbook, right? So sometimes we have to think, outside of the box. What does that really mean? But we have to think creatively, right? And realize that, what we learned in school and what it says is going to happen in the textbook isn't always the case. And we have to learn how to punt a little bit in order to shift based on everybody's individual needs. There truly is no one size fits all for autoimmune disease.
Now it's N equals 1, right? Like you're always working on the level of what this patient's bringing to this table. And I think we all get buttonholed, at least in the NMSK world, to trying to fit the same treatment or solution to the patient, and it doesn't work. Yeah. And then even your explanation and how you manage the patient with a condition is different because of what between the patient's value system, their support system, all of that. So you're right, N equals 1 there.
And it's also really important, I think, to meet the patients where they are, right? Like I'm an all or nothing girl. You give me a task, I'm going to jump in with both feet. But I have patients who literally can only handle that one task at a time, right? Or patients that need kind of in the middle, or they fail along the way, or they're so uber successful you have to shift quickly because they did such a good job. And if the clinician out there really isn't capable of meeting the patients where they are and walking on that journey with them, I think that's where a lot of the failure comes in too, in some of the treatment. Because at the end of the day, none of this is about me or my speed or my desires. It's really about the patient and their goals and their speed, and how fast they want to walk through.
Yeah, and you're right. Sometimes it's a straight line. Sometimes you gotta veer around the problem. But problem solving is an underrated part of being in medicine, I feel. So guys like myself, we work NMSK problems at Rossi, the company I work for. It's very hyper-focused, soft tissue injuries. We treat patients 3, 4, 5, 6 sessions. We can help them or we can't. But sometimes we have patients that need a referral. How do we search out or hunt out or make sure that we've evaluated and assessed that to find out who needs to go to folks like yourself that treat these problems routinely? Like what things in the history lead us down the route? This is not just NMSK. There's something behind door number 2 that needs a referral.
Yeah, I think there's kind of 2 parts to that answer. One is, to your point, when you say, let's say you're doing the soft tissue or the treatment and you believe it should work and it's not, that's a clue, right? So
failure of trial of care.
Yeah, that sometimes says to me like there's a nutritional issue or something else going on that's keeping you from accomplishing the work that you do so well, right? That should accomplish the goal that you didn't get. So that's number 1, is just the patient that just doesn't heal well or doesn't heal at all or doesn't respond. That absolutely can be a nutritional component. And then I think too, let's face it, our patients love to talk to us. They tell us about their constipation and their sexual health issues and their fatigue and their hot flashes and their urinary incontinence and all of this fun stuff that you're going, wait a minute, we were just doing soft tissue work. How are we talking about urinary incontinence, right? But they share, right? They're on our tables and they trust us and they share. And, I think any of those are good referrals, right? Because at the end of the day, most of them will wind up in another doc's office for a 5-minute appointment, with a prescription pad being pulled out for, a medication being written for a lot of
polypharmacy.
Yeah. And at the end of the day, again, there's an underlying cause for all those things I just mentioned. And, there's 2 beautiful things about that referral. One is there's really not much you could throw at me that I wouldn't take on. But 2, I also understand that whole, musculoskeletal component, right? The whole neuromusculoskeletal component to support what you're already doing and to help you so that you still maintain control. That's kind of a lousy word, but, control of that patient's care, right? So that
co-management
together, right? Absolutely. And that's really the beautiful part of the integration part that I think is fun within our realm of like-minded practitioners versus even the integration where I got to fight the battle of, do they need the medication or not? Because we have a completely different approach. So it's very supportive. So anytime a patient says anything to you outside of, what you're working on, it warrants a good referral.
Gotcha. Guys like myself, we often field questions from patients, and we do soft tissue work, hands-on work, rehabilitation. That's our niche and bread and butter. But occasionally, I'll give a patient just some general input on nutritional strategies, general nutrition for general health care. For the layperson out there or people like myself who just bare bones, is there 2 or 3 pieces of advice from a general health and nutritional standpoint that we can with confidence give to most, not all, most folks and say, you may want to do this, you may want to limit this or try this? Is there 3 good general health pieces of advice that we can give as NMSK practitioners or just the average folk that's listening to this?
Yeah, actually, a couple things. One, water, more water, lots of water. So, being that we're made up of water and, we're not born with a coffee deficiency or a Red Bull deficiency or, right, like any of those things. I find that most patients, no matter what realm we're seeing them in, just aren't getting enough water. So if we can start getting patients to drink water, and again, the water you put in your coffee is not water, it's just water, right? So increasing water intake is probably a really safe recommendation for most patients. Number 2, from a food standpoint, and this is going to be really easy because nobody has an hour to sit down with the patient, right, and dig through their diet. But here's just the general recommendations as I tell patients. If you can pull it off a tree, pull it off a vine, grow it in the ground, slaughter it. I know that sounds a little cruel, but that's our meat source. Or fish for it.
We're in Texas. There's a lot of that going on.
Okay, fair enough. So it's okay there. Then it's food. If it has chemicals or words on the package you don't understand, or it has an expiration date of 2 years from today, it's manufactured product. It is not food. So if we can just teach patients to eat a little bit more of that, protein sources, so our meat, our fish, our nuts, our seeds, our beans, our veggies, and our fruits, and we can eat more of our day in that realm, we're probably going to already make that shift away from manufactured product that's going to help us. It reduces inflammation. Again, it's going to feed, through nutrients into the cells, and we're just going to overall feel better, from that standpoint. So that would probably be my number 2. My number 3, and I'm giving you, I'm not even going the supplement realm, right? Because in case somebody's just not comfortable making those recommendations, I think the number 3, if we really want to go over the top, is to ask some of our patients then to pull out some very specific food groups, even if they're not eating what I just described. And that would be sugar, probably gluten, and mostly dairy. And the rationale behind those 3 food groups, and that's scary for a lot of people, is they just tend to be very inflammatory. So, as a doc, if we've got patients that have a lot of injury, a lot of inflammation, a lot of pain, a lot of times by removing those food categories from the diet, they will tend to feel better. And it's certainly worth saying, hey, give me 6 weeks, pull it out, see how you feel. If you don't feel any better, I'll be the first one to give it back to you, but let's see what it does. And I think
Cindy, why 6 weeks?
Yes,
I mean, is it an arbitrary number or is there something behind it?
Yeah, I made it up. No, no, here's kind of the rationale behind that. We always use 3 weeks as a starting point from from literature teaching us that it takes about 3 weeks to build a habit, right? So we need about 3 weeks to start that habit. The rationale for the 6 weeks is we've seen also in some of the literature that it gives the body the ability to kind of detoxify, if you will, from those inflammatory processes of the food. So think of it as almost giving the body a rest, where we remove something that's causing inflammation and we allow the body a little time to just kind of reset and heal and clear from that. And 6 weeks is a really good time frame to see some clinical changes. So, I'd love to tell you to pull it out for a year. Nobody's going to do that if they don't feel better, right? But most patients at about that 6 week mark still might not be perfect, but start to see enough change that now we've got buy-in, where they might go, doc, there's something onto this. You're onto something with this no sugar thing. Maybe I'll keep it out for a little bit longer to see how I feel. So that 6 week mark clinically we've seen in practice too is a really good time frame where, again, most people don't come back and say, no, I don't feel any better, and I can go, gotcha. It actually works.
Is that when you do the recommendation or prescription for an elimination diet, it's also concordant with that 6 week period as well?
Not necessarily. Usually we'll eliminate for at least 3 months, sometimes up to 6, depending on how severe it is. The 6 week mark, too, if you think about it, it's a lot less scary to patients. So if I say, look, we're going to start, the goal is 3 months. We're going to start with that 6 weeks. I expect you to feel a little bit better. It also gives them an expectation that isn't too far off, right? Because if I say you're not going to feel better for 3 months, that candy bar or the birthday cake or the glass of wine is going to look really attractive, right? 6 weeks is a lot less scary to commit to. And then usually, again, if we see 20, 30, 80% improvement, I can usually talk you into the remainder of the 6 weeks. Because
you get some buy-in at that point.
Yep, absolutely. Absolutely. And at the same time, if we really don't see any improvement at 6 weeks, then maybe we really are still missing something or doing something incorrectly.
So when a person like myself, an MSK provider, would send to a functional med integrated medicine provider, what types of things can we do to coordinate a referral to make this the transition to a provider like yourself seamless? Is it laboratory testing? Is it sending our notes? What can we do to better coordinate these referrals?
Yeah, you know what, and that's a great question. I mean, I would probably tell you not to do testing up front, only because you may not know what to order then, right? And then, the patient goes, they spend a couple bucks or some time to get some labs drawn, and then I want, 20 other things, and now they've got to go back and get resent some labs. So I probably wouldn't do any of that workup if you're truly referring, for that guidance. I think for me, I love just the quick, even phone call. We jump on the phone, you give me a little history on that patient. Sure, notes are absolutely lovely because I'll forget everything you tell me anyway. At a certain age, we do that.
Busy mom. You're a busy mom.
Yeah, the notes
Sports mom, too.
But just kind of your take, too. And then really, it's as simple as I've got to talk to the patient anyway, because, what we learn is the patient will tell me everything I need to know. And, at the end of the day, they're going to give me enough of a history that I know what direction to take. What you're going to share with me will probably already give me where I'm going to head, and they're just going to confirm that. But this way, I just, I know a little bit about what I'm walking into. I mean, in my world, I've been doing this for a very long time. There's not much you can throw at me that I haven't, seen or heard about or chatted about, right, with patients. For practitioners out there that maybe have a little less experience, certainly that heads up is nice so that, if there's any homework to be done. That being said, again, if you come up with some weird, crazy disease, and granted, I couldn't rattle off every single one that exists on the planet, the heads up is really nice too, in case we just have to do a little homework. Sometimes as doctors, we still need to do that to make sure that we're, really prepared for that patient.
Yeah, and in our space that we play in, some doctors, they like imaging, and some nope, all controlled. There's specific slices and protocols. I think everybody appreciates a note, a text if it's really serious, or a phone call like text. Can I call you on this one?
Right.
I've had to do that recently on a couple cases where it was something. One of my differentials is pretty serious and sinister and could require immediate action. So I think you're right, and getting it right. And in your case, hey, no labs, get the patient over, phone call or text, send notes.
Right. Now, if
so
you have like, let's say the patient walks in and they had previous labs even from another physician, I absolutely want that, because that also gives me pattern, right? And sometimes it's those things that we see in lab work, because not everybody has a clinical problem, right? We're always so obsessed about the ranges have to be way out of whack in order for us to do anything about it. And quite frankly, that's just so far from the truth. Sometimes we waver between being perfect and clinically sick. So if I start to see patterns over the years too that correlate with their symptoms, and yet there's nothing obvious, it may be because they're working on it, and we don't want to wait until it really shows up, 5 years down the road in the lab work. So I will take previous test results from, any other physician that's run them, just to give some history. Super important and helpful.
So a lot of people will advertise they do your style, for lack of a better term, functional integrated medicine. And then there's people like you. They're passionate about it. They do all the time. How does one find somebody that's truly good and truly passionate? Is it a certification? Is it a training? It's not a shingle on a wall hanging outside for the public to see. How do we find folks like you? I know you're in Orland Park, suburb of Chicago, but if I'm driving around Austin, or I got providers in San Antonio, Dallas, and Houston, how do we vet somebody that's good at this that we should send our patients to who need these services?
Yeah, it's a great question, and unfortunately, there's no little magic emblem that we put on our sign outs, out front that indicates what we do. My group, and I'm a little biased, one, because it's where I earned my, my diplomate letters behind my name, and I also teach in the program, is really the American Chiropractic Association. It's our council, the Council on Diagnosis and Internal Disorders. So if you go to aca-cdid.com, you can look up by city or state to try to find a practitioner in your area. But at the same time, we all still practice a little bit differently. So, you may have some people that practice very broad in that scope and still specialize very narrow. So you definitely need to make at least the phone call. There's some other organizations out there that are not necessarily chiropractic based, Functional Medicine University, IFM, that still teach in this realm. Some great practitioners, some not so great practitioners. Unfortunately, I think you get that in all aspects, of that training. The one thing that I think is really important is in the DABCI program, that's the group that I'm a part of, we do earn a diplomate, we do take a board certification, there are letters behind our name. Again, there is still no doctorate, though, in functional medicine. So when somebody says they are a functional medicine doctor, there's really no such thing, right? Because there's no degree in that. And even if you earn a certificate, it's just a piece of paper that you took some courses. So really, you need to trust that the education is good. The diplomate, I think, is important. Maybe finding out if they did sit for a board, because at least then you prove your value, that you did some work and you studied. You didn't just sit through class with some earbuds in and, sign the attendance sheet, I think are really important. And then, quite frankly, I think referral is the best. We get calls, oh gosh, every week, saying, hey, does Doc Cindy know anybody in Atlanta? Does she know anybody in Austin? And certainly if I do, we offer that up, if we can find somebody local. And then if not, a lot of us are doing telehealth at this point for that reason, because it's really hard to find good people in every single city that practice this way. So, trust your family and friends if they see somebody that way. Certainly you're welcome to reach out to me, or I can connect you with some colleagues that can offer some referrals maybe in their area too. But I'd love to tell you it's easy. It's a little bit of a challenge. There's no doubt.
Well, Doc, closing thoughts. A couple more minutes here. What closing thoughts do you have? We talked about a lot of stuff. I'm actually grateful for the information and the conversation. I learn from you every time I hear you speak. I've heard you speak professionally before. What closing thoughts do you have?
Yeah, I guess really just to your audience, and that is just don't settle. If anything's giving you a hard time, I don't care if it's a muscle ache and pain or it's fatigue or it's, hormone problems. I think we tend to settle, right? And do the whole, well, it must be normal, or we're getting older, or nobody can help me. And at the end of the day, a lot of things that we go through are common. It doesn't make it normal. And just as the body can go bad, I believe the body can go good. That's not very good English, but, it works anyway. And just never to give up, right? You just got to find the right person that resonates with you, that can help you with the care, regardless of what type of care it is. And when you feel comfortable, you progress and you get better. And when you don't feel comfortable, for Pete's sake, fire them and, find somebody that does better by you. But please just don't ever give up. We all deserve to feel amazing. And I really just believe that we all can. So, I just want to encourage all your listeners to, to seek that out and just don't settle.
And Doc, where can people find you? I know website, you teach, you've got a couple other things in the hopper. Where can folks find you?
Yeah. Oh boy, on a beach in Italy. No, I'm just. then I'll give you the home address.
I tell you what, that would be a great place. Yeah. You could do all your consults from an Italian beach.
Give me a few years, and that's where the truth will be. But
that's the end game there.
My office phone number is 708-479-0020. The website is Innovative, INNOVATIVEHWC, like for Innovative Health and Wellness Center.com. We're on Instagram at Innovative Health and Wellness. I'm on Facebook at Innovative Health. I'm in LinkedIn via my name, Dr. Cindy Howard. I guess if you Google me, you're gonna find me, right? If you just type in Dr. Cindy M. Howard, yeah.
Find a list of stuff. A lot of teaching credentials and seminars. Yep.
Yeah, and truly always happy to help. Whether it's just from a referral from another doc, whether it's a new patient, whether it's just getting you in the right place. Like always, please just reach out, because that's the goal. Is at the end of the day, we just want to help people get well, whether it's by my hand or somebody else's. It doesn't matter, as long as we get you in the right space.
And I'll vouch for that. You've been more than generous giving your time to me over the years with random questions, mentoring my wife and getting into the DABCI program too. And she's been a delegate for the ACA for the northern section.
Actually, it's all of Illinois now. Yep.
Yeah, so the heart of service, serving the people and serving the profession, and I don't know if anybody juggles as many things, and being an awesome, outstanding mom to 3 beautiful kids like yourself.
Thank you. It's fun. That's the greatest joy, right?
Absolutely. Doc, thank you so much. Doc, thank you so much for your time. We're signing off on the We Fix Pain podcast, episode 6 with Dr. Howard. Thanks. I'll put Doc's contact information down in the show notes. Thanks, Doc, once again.
Thanks, my pleasure. Thank you.
All right, bye.
Bye.